Good morning, everyone. My name is Dr. Pallavi Singh, and I apologize for not being there in person. But hopefully, at the end of this talk, you'll know a little bit more about my favorite tips and tricks when it comes to injecting hyaluronic acid gel. So, briefly, what we're going to be covering in this talk is some new concepts in orbitofacial aging, some general principles I like to keep in mind when injecting hyaluronic acid, and some area specific tips which I find to be very helpful in my own practice. So one of the things that I think it's important to stress about, and I think Dr. Rizuja already talked about it,
हाँ
but the concept of
ये निकाल
excessive
दो ना
skin, which was very popular earlier, has changed.
ओके
That concept has changed to volume loss as we age. So what essentially happens is that the subcutaneous and the deep fat pads that we have in the face, they tend to lose volume, and that gives the appearance of having excessive skin or sagging or drooping is what we see on the surface. So, keeping that in mind, I think the goal of using hyaluronic acid fillers for aesthetic treatments, the idea of using these fillers is to basically revolumize the face, replenish that lost volume that we kind of lose with aging. General principles that I like to keep in mind when injecting fillers is, first of all, less is more. So it's very important that you understand that injecting small amounts in the right area may take you a long way rather than injecting large amounts everywhere else. So very important to know where the placement is going to be. And the second thing, which I think is something that we don't really talk about very often, is just observing faces and understanding how lights and shadows play out on the faces. Because if you move the light reflex, even by a couple of millimeters, that can really change the way your shape looks. So essentially, what we're trying to do when we're injecting hyaluronic acid fillers is change that light reflex just by a bit and making the face look better. So, talking about area specific tips, one of my favorite areas to inject is the brow fat pad. Now, we all know the anatomy of the brow fat pad. It is the roof, which is the retroorbicularis ocular fat. It meets in the lower lid, it meets the SOOF over the lateral orbital rim. And essentially, with aging, you see a deflation of these fat pads. And what we're trying to do when we're injecting filler here is just revolumize these fat pads. And so it's important to know whenever you're injecting the brow fat pad that you always notice the 3D structure of the eyebrow, because the eyebrow is formed by the roof fat. And it's important to not get distracted by the eyebrow hairs, because you can pluck or laminate your eyebrows whatever way you want, but you cannot change the roof fat. So it's very important to look for that nice fullness, or to recreate that nice fullness whenever you're injecting in this area. For instance, if you look at Wahida Rahman when she was younger, she has this nice fullness which kind of has deflated with age. And so oftentimes it happens when patients come with a deflation of this, lateral fat pad. What they come to us saying is that there is excessive skin, and they want a blepharoplasty. So it's important to recognize where there is volume loss, and sometimes just refilling that volume can take care of their aesthetic concerns rather than doing a blepharoplasty. Now, where to inject? You want to inject just below the orbicularis, where essentially the roof fat pad is. And I like to inject laterally because there are no major vessels in this area. Obviously, medially you want to be very careful because you have the supratrochlear and the supraorbital, the neurovascular bundle over there. So that's important to consider. But just kind of going laterally and filling right below right below the subcutaneous area in the roof fat gives you a really nice result. This lady, she had these superior orbital hollows filling in the brow fat pad, really gave her a nice fullness. This man came to us after a blepharoplasty. His eyes look hollowed out. It's not a good look, and just filling the superior sulcus in the brow fat, it makes him look much more normal, much more youthful, so to say. The second area that I'd like to talk about is the teardrop, very commonly talked about area. The anatomy is something, again, as ophthalmologists, we're aware of that. The major vessel that we need to be wary of in this area is the intraorbital artery. And you know how the orbicularis is, and you have the orbital retaining ligament, above which, if there is deflation of the fat pad, that essentially forms what your teardrop deformity is. And you remember the roof and the SOOF pad we were talking about earlier, when they kind of deflate with age, what you get is this orbital rim hollow. So where we would like to inject when we're talking about tear troughs, and now this is important, you want to again inject in the SOOF fat. So it's going to be in the suborbicularis layer and the preceptal layer. I like to use a needle over here rather than a cannula because the skin is very thin in this area. So you'd rather place small aliquots of filler in multiple areas and rather than injecting a bolus in one area. So small amounts, I think I tend to get more precise results with the needle over here, and that's what I prefer. And so this is just a short video. It just goes to show you that you want to keep your needle almost flat, just below the orbicularis muscle here, and just do small amounts, like really zero point 0.2 or zero point 0.3 cc's of filler. And then once you've injected, you also want to use your finger to kind of flatten it out because you do tend to get lumps. Filler does tend to get a little lumpy in this area, so it's important to be cognizant of that. Tear trough filler, the good thing is it lasts for a long time. This was a patient I did, and the below photo is a 1.5 year follow-up, and you can see that she's doing really well. I don't think she's going to need another layer for a year. So it lasts for anywhere between 1.5 to 2.5 years, and you just need small amounts in the right places to make a good difference. Again, another area that is one of my favorite areas to inject is the temporal fossa. Now we know what the temporal fossa is. It's essentially this bone which lies behind the lateral orbital rim and above the zygoma over here. And what you have on top of that is the temporalis muscle, the deep and the superficial temporal fascia. And what happens with age is that all of the muscles over here start to get resorbed, and the subcutaneous fat pad also tends to get deflated. So what that creates is a big concavity on the temporal fossa, which is a sign of aging. It does not look good. So when we're trying to rejuvenate this area, what we really want to do is just fill out that concavity. Now, we know that the neurovascular bundle in this region lies between the deep and the superficial temporal fascia. So I think it's what I like to do is just go straight down to the bone. You're piercing through the muscle as well. And if you're injecting over the periosteum, you know that it's pretty safe. Just go straight down perpendicular to the bone over here. And you're not going to sort of encounter any vessel over there. So I think it's a safe area to inject. And what you can really do is just inject a slow injection, and you can inject a bolus of about one, zero point 0.2 0.2 cc's or zero point 0.3 cc's, and you can just see that sort of temporalis muscle bulge out. And you can see the before and after pictures over here from this paper by Val Lambos. You can see how she's got this really big deformity on the left side, makes her look hollowed out, makes her look old. And on the right, after the filling, she looks much more natural. And one of the good things about filling the temporal fossa is that it looks better, but nobody can really tell what has been done, which is essentially, the basis of all aesthetic medicine, that you should look like yourself, but people shouldn't be able to tell what has been done. The fourth area that I'd like to talk about again is something which is very commonly talked about, the mid-face filler. I think over here it's just important to understand, number one, the anatomy. We know that the highest point of the face, so to say, is kind of right here in the pre-zygomatic space where the zygoma takes a turn to the back, and it's important to understand the fat pads over here. You have the deep lateral cheek fat pad, and medial to that you have the medial fat pad, which has a superficial layer and a deep layer. So just understanding the anatomy is important because we want to revolumize these fat pads. And what happens with age is as they lose volume, your cheeks tend to sag down, the nasolabial folds become more prominent. So that is the thing that we want to sort of reverse or correct. Now, in terms of where to inject, a lot of people like to sort of draw a line from the lateral ale of the nose to the tragus and draw a line down from the canthus. I think for me, I find it more helpful if if you just palpate the zygoma over here, right at the bottom, the inferior orbital rim, and you can see the zygoma, and you can really feel the point where the bone, sort of turns backwards, and that is the highest point. So where you can inject over there, you have the transverse facial artery and the zygomatic facial artery again in that area. But if you go right down to the bone, I think it's pretty safe because the arteries are more superficial. Another trick that I like to use for this area is like I like to use the cannula because you can create multiple tracts and then you can inject as you're taking the cannula out. So that creates a more uniform kind of lifting effect. And I heard Dr. Debraj Shom describe it very beautifully. The whole idea of injecting in the mid face is thinking of a tent and you're holding a pole to sort of lift up the tent. And so what that does is when you're injecting in this area, you're lifting all of these tissues up, and that gives support to your nasolabial folds, effaces them, also gives support to your orbital rim. So just an overall good effect on the face. But I think it's also important to understand whenever you're injecting the cheeks, to not overdo them and to understand that you have to harmonize it with filling the rest of the face. So you can't just go nuts in one area and start injecting like about 1 cc here and 1 cc here and not inject in any other part of the face. So just doing small balanced amounts on in the entire face is more important than injecting more in one area. So these are some befores and afters. After mid-face filling, excellent results in these cases. But these were also, good cases to sort of inject filler in. The last area that I'd like to talk about is the piriform fossa. Again, one of my favorite areas to fill because I feel like it gives you, the biggest bang for your buck, so to say. Now, what is the piriform fossa? It's this fossa over here. It is at the base of the ala of the nose. Medially, you have the levator labii superioris, and laterally, you have the deep medial cheek fat, enclosing this area. And the vascular structure that we need to be sort of, cognizant about in this area is the angular artery, which runs in the roof of the space. So what happens with age is the maxillary bone gets resolved, as you can see here, and the nose kind of tends to go back, leads to elongation of the philtrum, and the lips also tend to sort of evert out. Not a very good look. And if we inject filler in this area and sort of replenish the bony volume, what you do is pushing that whole structure forward, giving a more natural look to the philtrum and the lip. So not only it effaces your nasolabial fold, but it also provides support to the lip, which is something that is not really talked about, and it can reduce the amount of filler you might need for your lips. So that's an important point to keep in mind. Now, where you want to inject, again, in this case, because the angular artery runs in the roof of this space and it's a little superior, I like to inject right here and go right down to the bone, because again, when you're touching the periosteum, the chances that you've hit an artery are really reduced. So I think it's pretty safe to do that. So go right down to the bone. You can inject, sort of slow injection again of a bolus of about 0.1 or 0.2 cc's on each side. And then you can always come out, see how much of a difference it's making, and then go in and inject again. And I think it makes a really good difference. So you can see here this lady, if you look at her lips in the picture titled B, they look much better, but she's had no lip filler done. The only thing they did was provide, support to the to the piriform fossa, giving it that forward projection that looks very nice. This was one of the patients I did when I was at UCLA, and you can see how her nasolabial folds are effaced, and it looks better. So again, I think one of my favorite areas to inject. So to summarize, I think it's important to understand that a lot of your upper and mid-face aging relates to the loss of volume in the subcutaneous and the deep fat pads. Less is more when it comes to filler, and I cannot stress that enough. Very important to understand how lights and shadows work. It's always helpful to sketch or to just observe photos just to see what a good sort of what an ideal face looks like. What the lights and shadow how they play out, because that can help you in deciding where to inject. One short tip for each specific part that I talked about. Eyebrow filling, always think about the three-dimensional shape of the roof fat. Don't get distracted by the hairs. For the tear trough, always do small aliquots in multiple spots rather than doing a bolus injection. For the temporal fossa, it's always safe to inject underneath the muscle so you can go perpendicularly. And always remember that when you're filling the mid-face and the piriform fossa, you're kind of replenishing the lost bony volume. So keeping that in mind can help you design your injection pattern. I'd like to thank Dr. Gorberg for teaching me everything I know about fillers, and hoping to see you next time in person. Thank you.